Hi, this is Sona Sarni, a practicing speech language pathologist at Lorem Wellness Care. Today, my topic of discussion is the role of speech language pathologist in dealing the patients with dementia. Dementia is a group of thinking and social symptoms which interferes with the daily life of the patient. Dementia is a group of condition which interferes with at least two of the brain function, which include memory loss and judgment. Moving on to the causes of dementia, there are different types of causes for the dementia. The main cause include Alzheimer's disease, Parkinsonism. Third one is frontotemporal degeneration, Lewy body disease, etc. Based on the cause of dementia, we can classify the type of dementia accordingly. Some of the common causes of dementia include diabetes, medications, infections, environmental poisoning. What are the symptoms of dementia? The main symptom of dementia is forgetfulness. Second one is memory loss. Third one is personality changes, anxiety, hallucination, mood disorders, etc. All patients with dementia doesn't require speech language therapy. Based on the severity of dementia and consent from the patient and the family member, we will tailor the speech therapy for the patient with dementia. As a speech language pathologist, we will evaluate the patient as a whole and will propose the goals based on their strength and weakness, and most of the goals will be functionally useful. The goal of speech therapy in patients with dementia is to preserve their memory, their cognition, their language, and to manage the difficulties with swallowing. Initially, we will train the family members or re-educate the family members about the disease or the condition in which they are in. So, why we need to educate the patient's family members? Because most of the time they spend their time with their family members and they need the support from the family members itself. The foundation of the therapy is the family members and the support from the society. Through the interaction with the family members, we are able to understand the strength and weakness of the client and the moment, habits and priorities. As a speech language pathologist, how do we work on memory? As we all know, there are different types of memory: short-term memory, long-term memory, working memory, procedural memory. How do we work on memory? What all we can do for it? A speech language pathologist will make sure the patient is using memory cards or reminders, calendars, etc. We will make sure that the patient is using a list of common objects, names, family members' names in order to memorize everything. As I said earlier, the main goal of the therapy is to preserve the memory. How can we preserve the memory? Through the environmental modifications, which include medications, food, exercise, pleasant environment with soothing music, and daily scheduled routines. A speech language pathologist will deal with the cognition, swallowing, language related issues of the patients with dementia, along with the proper support from the multidisciplinary team, which include a neurologist, a nurse, the supporting system, and a speech language pathologist, occupational therapist, recreational therapist. They can do better in their life.